Hi, I'm Paul Wilson. I'm a physical therapist in Knoxville, Tennessee at Prompt Physical Therapy, and I'm here with Dr. Brett Smith today to talk about bone stress injuries.
Yeah, Dr. Brett Smith, internal medicine and rheumatology physician at Tennessee Director of Rheumatology and Executive Health. Glad to be here with you, Paul.
Yeah, awesome. Thanks for having me. So first off, we're going to talk about bone stress injuries, but we wanted to preface it with why this is important. Is it something you don't necessarily hear talked about quite as often as other injuries on there? So bone stress injuries are a debilitating injury that are fairly common, especially within the endurance world. Not just the endurance world, you also see them in the military population as they're getting back to activity. Anyone that's having a rapid increase in physical activity can be predisposed to these on there too, but it's something that's oftentimes misdiagnosed as a individual that might be suffering from it. We oftentimes don't have a framework around what this is and what it should feel like. And then even as medical providers, if it's not on our radar and if it's something that we haven't seen recently, it can be really easy to misdiagnose this as some type of other muscular or tendinous injury when it actually is a bone stress injury that needs to be managed very differently.
Yeah, I agree with that. So you really need a team approach to this too, because we have very different expertise, and it comes in handy for the individuals with BSIs. So your expertise in physical therapy and sports medicine and rehabilitating people, along with maybe a medical approach to different aspects of BSIs, including risk factors, nutrition, other aspects to laboratory workup. But a BSI is it's something that it's probably not commonly recognized by a lot of medical providers because a lot of people are not necessarily trained in musculoskeletal medicine in order to identify BSIs as well. So really you want somebody who's familiar with BSIs like yourself or me or some other people in the community, just because there are people that are, especially these endurance athletes, as they are the ones that are the prime candidates for BSIs or bone stress injuries. But also there are other people that are simply returning to activity that maybe need a little more guidance on how to escalate their activity, how much nutrition to have, and they develop aches and pains and stress fractures and things too, and they don't get enough guidance, and it severely limits them over time, and it's never fully diagnosed without the appropriate team.
Yeah, definitely. So as far as who's susceptible to bone stress injuries, we'll talk about that a little bit. So we were looking at a study that was showing the prevalence of bone stress injuries. The people that are most likely to get a bone stress injury are cross country and track athletes, especially high schoolers on there as well. Females are more likely than males, but both males and females are predisposed to this injury. What other populations have you seen bone stress injuries in?
I've seen bone stress injuries, and not only in the athletic population like you have, of course, too, but I've actually seen young adults and middle-aged adults that are actually returning to injury that develop these BSIs or bone stress injuries, whether that be the injury itself or a stretch fracture for no apparent reason, simply because the workload increased too fast, they were not necessarily prepared, or they actually had inadequate nutrition for the event, or there was some sort of hormonal disruption. So I've seen it in young people, I've seen it in middle-aged people as well, but it's actually a more challenging one to diagnose.
Yeah. And then as far as bone stress injuries and how we can prevent them, there's a couple ways to think about it. One way that I've heard from someone smarter than myself is looking at it in kind of two different environments. So there's the loading environment or the stimulus that's being put on you, whether that's the exercise you're doing, the physical activity. And then there's the physiologic environment, which is your calories, your nutrition, your supplementation on that as well, too. So there's kind of two sides of it. And that's really why it does require that team approach, because I can do everything in my power to help have this person have a good approach for training. But if the nutritional stuff isn't there, then they're still at a very high risk.
Right. So there is a lot of prevention to be had there too. And so I think if you've had a BSI one and you incur another BSI, yeah, I think it's definitely time for a team approach on that one, because that's an ominous signal that something's wrong and we need to work on either the workload, symmetrically or biomechanically something's wrong. Nutritionally, we're not fueling right or fueling appropriately, or there's something medically that needs to be explored as well. So there could be a variety of factors there too. If it's an incidental first-time prevention of or a first-time BSI, certainly there are preventive measures that you and I can help with that would actually prevent second or third BSIs that are so debilitating. But from a preventive standpoint, it really is about appropriate supplementation, nutrition, and really stimulating bone in an appropriate way from different angles and different levels of activity and rest periods, really to optimize that person's performance and their quality of life.
Yeah. So from the training side of it, what can we do to minimize bone injuries and bone stress injuries on there too? So I think one thing is starting young and starting young with multi-directional sports. So there is some evidence that sports like basketball and soccer are very preventative of bone injury because you're loading the bone in multiple directions versus a sport like running where you're just running in one direction or moving in one direction and loading the bone in one direction. So I think having a non-specialized approach when you're young and just exposing your bone to multiple different types of stimuli goes a long ways for starting to create this environment to allow for a healthy bone structure for the rest of your life.
Yeah, I totally agree with that because there is studies actually talking about optimal workload for people with BSIs, and there is a golden window of opportunity for adolescents, teenagers, and people in their 20s that is the bone building phase in order to use it like a retirement account, which you've said before, to actually bank and get those BSI risks down in the future or get your recovery up because that's when bone is predominantly built. You can still build bone later in life, but it is far easier to build bone when you are a teenager and you're young.
Yeah. And we will eventually get to a point where we do see bone density decline, right? So
Right.
the higher that we can build that up now, you decline from a higher rate and then stay functional and stay strong from a longer point. So the more you can do to build that bone density at a young age on there too. So outside of playing youth sports when you're young and being exposed to multiple stimuli and jumping and running in different directions and not just doing one sport, what are some of the other things that we can do from a training point of view to help with bone density?
So from bone density, if you hear the medical literature on bone density too, so besides from what we're talking about of actually loading when we're young, because that may not be an option for somebody as they've aged. They've passed that period, right? But in general, what we say is that resistance training, even from a medical standpoint, from a health span and longevity standpoint, is critical to maintaining bone mass. And we've talked about some of the volumes and some of the intensities that are needed. Most people probably should be working out, like you've said before, at least probably 70% of their 1 rep max in order to achieve adequate bone density gains. In the literature, it really is ideally probably at least 2 times per week of resistance training. Adding some plyometric volume in there as well is even important for health and multi-directional. We've seen people with Achilles injuries, Achilles ruptures, people with BSIs, and it really is because we're allowing our bodies to drift. We lose approximately 0.7 to 1% of our muscle every year starting around, age 30 to 35. And so we're drifting. And so if we're not pushing, we're biomechanically becoming more unstable, actually, and we're becoming more single plane, like frontal plane, like you're referring to, where we're walking, getting up and down. We're not moving laterally like we were earlier. We're not moving diagonally. And so getting that planar, even as an adult, 2 to 3 times per week, goes a long way in aging well and preventing BSIs and other injuries with age.
Yeah, and I think sometimes, even amongst the general population and even amongst the endurance population, there's this fear of heavy load on there too. But when we look at the literature, it does require relatively heavy load. And when I say heavy, it means heavy comparative to your baseline or your strength on there too. So everyone's going to be a little bit different. But we're working at a relatively high percentage of our one repetition max, or what's the most we could do. Probably somewhere between 70 to 90% is going to be where most of the literature is on there too. So we do need external load to build that bone density. So walking, running, these low impact activities, though there can be a lot of benefit from it cardiovascularly, they're going to do very little to stimulate our bone too.
Yeah, that's absolutely right too, is that, it's not a bad thing to do. Walking and running and things are good for our health. But when you talk about medically building bone, unfortunately, they just don't build bone. That's the reality of the matter. And so I encourage people that if you're going to walk, consider adding a weighted vest, for example, too, or carrying dumbbells or a kettlebell with you in order to load bone a little bit more. But engaging in at least probably 30 minutes of resistance training twice a week is really what you need, with some additional plyometric when somebody else is ready. In terms of over-the-counter agents that are able to, we need building blocks to build bone. So we need that calcium, we need that vitamin D in order to build bone appropriately. We need it on a regular basis too, but by itself, it's like having the building blocks for the pyramid with no workforce too. We can't build the pyramid without the workforce. These activities that we're talking about are what allows us to build bone, but the calcium and the vitamin D are the foundation. They're the building materials for the house and, the condos and such.
Yeah. So just to wrap up on that, if I'm kind of just combining our kind of understanding of what we've been looking at recently, what people can be doing to build bone density. So strength training 2 to 3 times a week is where most of the literature would put it, and then working at relatively high percentages of their workloads. And it doesn't need to be a ton of volume, 2 to 3 or 2 to 4 sets, somewhere between 3 to 10 repetitions or 3 to 8 repetitions, 2 times a week. With plyometrics, the literature I've seen, 2 to 3 times a week, 2 to 3 sets of 15 to 20. So that's something that you could easily fit into a 30-minute window 2 to 3 times a week.
Right. And you probably just want to work with somebody if you don't have a lot of experience on a beginner or intermediate level in order to ensure that the training program is adequate for growth and for safety and for meeting your goals as well. So somebody like yourself or a physician who's experienced in sports science and other aspects.
Yeah, and the big thing is it needs to be relatively more loading than what you're doing currently. to build bone density. So it doesn't need to be this huge jump in activity. So
Right. So those are all good points, I think, right?
yeah. And then so we have those are basically what we can do to build bone, but then we also have the environment that needs to be there to allow those things to build our bone density. So can you speak to a little bit of what are some of the key things that we need to have in our kind of physiologic or nutritional environment to allow that bone density to develop?
Yeah, it's a great point too. So you can actually have the nicest car in the world, but if you don't have any fuel in the car is not going to go anywhere, right?
Yeah.
So so nutrition is very important too there. So really, when you think about nutrition, it's adequately providing the base for us to do things. So the energy for which we do things, for which we build and we grow and we repair ourselves, really comes from nutrition and from food. It really is, if we think about macronutrients, which are defined as protein, fats, and carbohydrates, none of them are bad. They're all good in their own respect. It's really a matter of balance. So when we're looking for things that actually build the skeleton too, it really is a balance of all those things. But for the athlete and for the person that is actually going through fitness and growth and bone density, really it's an adequate amount of protein and carbohydrates are probably the biggest thing. You know, carbohydrates, they get a bad name sometimes too, but in general, carbohydrates are energy. They are fuel. Protein is the building blocks for maintaining muscle, which helps to build bone as well. But really achieving an adequate amount of protein intake daily from a variety of protein sources, fueling carbohydrate-wise in advance of activity 24 to 48 hours to build glycogen stores is really important too. And achieving, really trying to maintain somewhere around your basal metabolic rate or even a slight surplus to simulate growth is the idea. But you need to work with somebody who's skilled to understand what your basal metabolic rate is too and what your macro breakdown needs to be and making sure you're not missing any micronutrients that could cause you to become deplete even if you have a well-rounded diet in your view.
Yeah, absolutely. I think anyone that's had a bone stress injury, is rehabilitating from a bone stress injury, or is typically at risk for a bone stress injury, every single one of those people I see, I send to someone like Dr. Smith or a nutritionist to get some expert insight into that.
Yeah, and so you need somebody for BSIs as well for prevention and for treatment too, somebody who's dealt with BSIs like yourself from a lot of runners and other injuries too that can actually take you through a standardized process that has experience.
Yeah, absolutely. As far as some of the risk factors for bone stress injuries, what are some of the risk factors you've seen in the literature for what makes someone more at risk of developing a bone stress injury?
Yeah, I think to understand the risk factors too, you kind of have to step back to the mechanism of bone injuries a little bit too. So when we think about how bone is built, bone is an ever-evolving process. It's not stationary like a rock sitting on the ground. Bone is actually built and taken away on a routine basis too. So we have two types of cells. We have the osteoblast and the osteoclast. The blast is our building cell. The class is our taking away cell. So you don't want the osteoclast, like the dump truck, to be escorting more materials than are coming in to dig yourself a hole. So when you talk about the risk factors too, is that if you have an excess training load, so you increase your training load substantially, 20, 30%, for example, you might actually see that training load is causing more bone to be taken away than is being built. Because bone takes time to be built. Bone takes months sometimes to settle and even a full year for mineralization if it's cortical bone. Trabecular bone is a little bit more bioactive and sometimes, but it can take longer for mineralization. A lot of the BSIs are actually trabecular bone compared to cortical bones. Sometimes it takes a lot longer. But in terms of the risk factors too, we would say it's excess training load from our perspective too. You can speak to that, I'm sure. But it's under fueling is probably a big one too. And so people that have relative energy efficiency of sport or RED-S, those individuals are under fueling for their demand. And it's a tendency by a lot of people to either over or underestimate their calories. Historically, by experience and in the literature, endurance athletes tend to underestimate their calories, and they tend to, if they have BSIs, underestimate their training load as well. So I think that's important to put together. But really, it's an adequate intake of calcium, vitamin D, macronutrients, and really not under fueling on a consistent basis.
Absolutely.
All right, so we've talked a lot about BSIs and their diagnosis, their symptoms, the prevention of BSIs. Now let's talk about treatment of BSIs now.
Yeah, so when it comes to treatment, I think it's really important to have a team approach. So I am not comfortable treating bone stress injuries until they've seen a physician and most of the time had an MRI done. Based off that, we can get a grade. Oftentimes we'll use Fredrickson's system, which gives us a 1 to 4, 1 being more of a stress reaction, 4 being a stress fracture that has a fracture line on there as well. So we want to know how severe the stress reaction or stress fracture is. The other thing we want to know is the location of it. So for instance, if it's in the femoral shaft, so in the middle of their femur, that's a low risk injury because it's a relatively vascular area or there's a decent amount of blood supply to that area, versus if it's in the femoral neck, so higher up in the hip, that's a high risk area. So meaning that there's more risk of complication if something does go bad there. So based on those two things, there's in kind of a team approach, there's a decision on how long that person needs to be relatively unloaded and how unloaded that person needs to be. So that might be something where we just say no running, but you can walk and go about your daily activities. Or if it's more of a high risk area, it might be something where they're in a boot or a cast for a period of time. I would say in general, 6 weeks typically tends to be about how long it is. But we do want to make sure that the person is comfortable with daily activities before they get into any rehabilitation type exercises. From there, we're going to go through a couple different stages. And depending on the severity, the stage, and how long each stage is, and then making sure the person's comfortable in each stage will kind of dictate how long each stage is. But we're going to go into a period where we're doing weight-bearing strength training. So they're doing body weight exercises like marching, step-ups, squats, different single leg balance exercises, calf raises. As they get comfortable and have had a couple weeks of that, we move into adding load onto those. So adding on dumbbells, kettlebells, eventually heavier weight like barbells on there too. And that's typically going to be about 8 weeks during that phase. Might be a little shorter if it's a low grade injury on there. From there, we're going into our plyometric training. That's when we're restoring our body's ability to tolerate rapid load on there. So we're doing different hopping drills like we talked about earlier. We're going to do hopping in multiple directions and multiple planes to be trying to stimulate bone density on there as well. And then from there, that's when we start getting back into activity. If it's running, we'll start them on a graded return to run program where they're running typically every other day and then doing run walk intervals on there as well. I think an important thing to note during this process is, so typically people are going to be unloaded for about 6 weeks. Bone density drops to be the very lowest at 12 weeks after injury. That's when we tend to see bone density the lowest after a bone stress injury on there as well. So as they're returning back to injury or returning back to activity, they actually have the lowest bone density at that point. So it does require this prolonged process of not just saying, hey, they're not symptomatic or they're not in pain, they can get back to activity. Because even systemically, not just in the involved limb, in other areas of their body, their bone density has gone down during that 12 weeks on there too. So we start to lose, when we unload someone, we first lose muscle. So we start to lose muscle strength and muscle mass. And then after that, we start to lose bone density and bone function. And then when we get back to activity, it's inverse of that. So we start to gain back muscle, and then it's slower for us to gain back bone. So it does have to be this slow graded approach. It cannot be just this, I feel better, now I'm going to slowly get back to running, because oftentimes if someone does that, they just end up getting another stress fracture somewhere else, and that's what we really want to avoid.
Yeah. So that's a great overview. So as far as like the medical side of this things too, so one of the important things is we have a BSI. We really want to make sure that there's no other underlying condition that is contributing to the risk of BSIs as well. So we probably would need some basic laboratory studies and maybe a little bit deeper dive in terms of history and physical exam, and maybe some imaging, of course, there too, to look for other incidences that may be more important for what's going on. Really addressing the adequate intake of calcium and vitamin D would be really important too. Assessing how much dairy somebody's taking in, if they're not taking adequate dairy in, or if they are, really making sure that calcium level is at an adequate level of at least probably 1,500 milligrams per day. Vitamin D is a critical player. If we did the vitamin D literature also in BSIs, vitamin D is a critical player in terms of the levels. You know, we want to see theoretically at least somebody of a level of 30. It might be ideal to see them over 40, but a daily supplementation of vitamin D is going to be beneficial. And also is assessing for nutritional deficiencies. So it's consistent intake throughout the day. It's an adequate carbohydrate load, even coming up with a more comprehensive meal plan too for food sources and for timing of intake as well. Preloading for people and then loading in advance for 24 to 48 hours as well can be a good idea from a prevention standpoint and a treatment standpoint, because nutrition plays a key role, as we see a lot of athletes and a lot of young people who are not fueling for the amount of demand they have. And certainly in relative energy deficiency of sport, we see quite a bit of people that in the literature that are under fueling and underestimating their training load and overestimating their caloric intake as well from a treatment standpoint.
Yeah, absolutely. And I think that's why it takes a team approach, because there has to be the nutrition and the physiologic environment for the loading to work. So what I'm doing as a physical therapist isn't going to be effective if the medical side of it is not in line. And then the same thing, if they're getting their hormones dialed in and getting their nutrition, but they're not actually loading the bone in an adequate manner or having a lot of training errors, then the stuff they're doing on that end is not going to be as effective. So it does really have to be this team approach to manage these people well.
It does. It has to be a team approach. And, we're talking about things like your approach specifically to BSI is unique, and getting that nutritional, laboratory, and even that hormonal approach to make sure that there's no incidence of hormonal abnormalities in males and females or the athletes as well is very important in their high energy demand states.
Yeah. And it's a trickier injury to manage. It's a lot different than oftentimes runners and athletes, and just everyone's had a hamstring pull or a muscle injury, and there's this level of it kind of hurts, but it's okay. I can push through this a little bit. Bone stress injuries are just a completely different beast, where oftentimes after we've injured it, when we're turning back, if we do get to that pain point, it's almost too late where we've kind of re-stimulated that injury again. So you really do need to have a team of people around you that can help guide you back through that process, or else you're in a very difficult situation.
Yeah, so especially if it's even the first BSI or you've had more than one BSI, that team may be really important for preventing future injury because they are so debilitating.
Yeah, definitely.
Yeah. So I think we've had a good conversation today. Hopefully we'll have some more in the future, right?
Yeah, definitely. We will.
All right. I guess we'll see you next time.
Sounds good. Thanks, Brett.